Good evening, everyone. You've tuned into the HIV Positive Show with Yannick, Chido, Jara, and today we have a very, very special guest called Donna. Donna, can you please introduce yourself to our listeners?
Hello, I'm Donna and I'm a psychotherapist. I'm working with people living with HIV and I'm working across Walsall and Wolverhampton.
Thank you, Donna, for coming. And today we will be talking about living positively, HIV, relationships, disclosure, and mental health.
Yeah. Wow.
Girls, hot topics. Are you ready?
Wow.
Yan, how are you feeling this evening?
I'm feeling excited.
Good.
I remember when you sent the program earlier and I was like, ooh, I want everybody to be listening in today. So yeah, I'm excited. How are you feeling?
I'm great. Yeah. I'm absolutely great. And today we've got different segments of the program. So the first hour we'll be talking about understanding HIV and its impact on relationships. Welcoming, obviously, what you've done. And then we'll talk about personal experiences, because I think it's really important that we do hear from personal experiences, because people who are living with HIV have more experience than us clinicians, because they go through it day by day. They actually make us better clinicians. That's something I believe in 100%, because lived experiences where you guys teach us is immeasurable. So thank you. I always learn from you guys. The third segment will be HIV facts, relationship and myths. So I'll be Miss Boston today. So I'm hoping, listeners, you will be able to answer some of those questions and see, because it will be really interesting for us to know what your HIV knowledge is. And if you've got any questions as well, but really, really important for you to ask those questions. This is your time. I always believe that knowledge is power, so do please engage with the show. After the show, if you've come across anything that you're thinking, oh, I'm not sure, please do try and ask those questions. You can actually join us on YouTube. You can even message on Instagram. So we've got lots of social media.
Yeah, HIV positive show.
So it's your show, and please do engage and make it yours. Okay,
and don't forget the online chat as well.
Yes.
Once you click the link, you go to the link, you go to the bottom of the page, and there's a chat on there as well, so you can leave messages on there or questions. And hi, Sona. Good evening, Jara and crew, she says.
Hi, Sona.
So, yes.
Welcome.
So you can give us a shout out. Let us know that you're listening in. Ask any questions. We're here, guys. So, welcome.
Welcome, everyone. Right, so we're going to dive in straight away. Donna. This is...
Hello.
I think... if you can just give us a bit of your understanding of how it feels about working with HIV patients and the patients that you see, what they go through, especially when it comes to the impact on their personal relationships and sexual relationships as well.
I'm seeing people, I work across, as I say, Walsall, Wolverhampton, and I'm seeing people in clinic when I'm working, coming with a diverse range of issues related to a HIV diagnosis. You can't always say it's one size fits all when it comes to diagnosis and how people are going to interpret that. Some people are quite accepting of it. Other people really struggle with it, and we see trauma a lot in our clinics. And when people come to see me, sometimes they're in a very dark place, coming to terms with their status, their new status, and how that is going to affect their lives. So we have to be very sensitive about it. And but other people are quite accepting of it, and they get on with their lives and they take it in. Some people are very open about their status. So it's not one size fits all, is it, when it comes to interpreting the diagnosis? So for me, like you said, Jara, the person living with HIV is always the expert in the room.
Yes,
always
absolutely.
The expert in the room, because as much as I can empathise, be in the corner with someone when they are in a dark place or when they're coming to terms with things. It's really important that we listen, we understand, and we take things on board as well as clinicians, because that is really important.
Yeah.
And respect, obviously, always. And I think if you can bring a bit of compassion in as well, that's always good. Mm-hmm. So for me, that's part of my job. Yeah. No 2 days are the same. And I'm sure that's the same for you, John.
Yeah. Absolutely. It's exactly the same. And respect is very important.
Yeah.
And I think as clinicians who work with patients, it's so important that we do listen to the patient's voice.
Absolutely.
Patients know their body. They know how they feel more than us. And I think sometimes the mistakes that we make, and quite a lot of us, including myself, I'm not going to exclude myself from that as a clinician. Sometimes we do make those mistakes. Yeah. Because sometimes you look at the clock, you're worrying, you're not even listening to what the patient is telling you. Yeah. And all we are focused on, this is the model I'm going to use, so I'm only thinking about what I'm doing. But it's so important for us to listen to our patients. And really interesting that you said some people are accepting. From your experience, do you think that, this might be anecdotal, that people that really struggle with their HIV diagnosis tends to be women and usually Black Afro-Caribbean?
Yeah. I would say the majority of women that I see in clinic are Black African women. Many have got other responsibilities in life as well, mothers. Yeah. Also, relationships can be an issue, accessing healthcare, mental healthcare. Yeah. It's difficult for many, and the problem is people become very isolated in their communities then, and that's where we start to see the impact of that on mental health as well. Yeah. So I would agree. And even we've got a local women's group, the Women's Network that we've established. Yeah. And would you agree, Jara? Yannick and Chido. Yeah. The majority of women there are Black.
Yes,
African women in the group.
Which is so good. That's a powerful thing to have, because I think creating a group where you walk in, you see your own people, it's very, very important. Because I think we are isolated. Yeah. Okay. And this is not only with HIV. You do see that with quite a lot of other physical diagnoses. Yes. Yeah. Cancer is one of them. Yes. So you go into groups whereby when you go into these groups, you're thinking, actually, nobody speaks my language. Yeah. Nobody understands the food I eat. True. The dietitian is telling me, this is what you need to eat. You need to eat salad. You need to eat that. Well, hello, I'm African. I know about rice. You know. So I guess having to go into a group where you see your own people, it's powerful. It is so important because it makes you feel that you belong, and also you feel that you're not isolated because you can share experiences. So you're thinking, hang on a minute, actually. That's okay. The way I feel, it's okay. Yeah. Because I'm not the only one feeling this way. Mm-hmm. And the family dynamics, which you've touched on, it's because as Black women, especially, our responsibilities in this country, we tend to be the one running the home. Yeah. And then you can have uncles and aunties, everybody living around, and you're taking your medication. You don't want people to know what medication you're taking. And already, because we attach so much stigma to HIV, you don't even know who to trust. So therefore, you are in the shadows. You're hiding. Yeah. So if you think about the mental health impact, you know, because you don't want to share, and you're thinking, why am I in this dark place? And then you go to clinic. They said, okay, you need to go and see your mental health team. There is no mental health service. I'm sorry, it's rather unfortunate to say, but in this day and time, you do not have a mental health service. And for HIV clinics, kudos to us, because I think we're very good, because for every HIV clinic I know, they do have a psychotherapist. That is something.
That's good.
Which you know quite a lot of services don't have. You know. So, and I can't, and this is why the three of us came together to put this program together, because it's about people listening and knowing how lonely it is out there, but also to reiterate that stigma is what kills us. Not the HIV infection.
And I think as well for me, it's kind of complicated for myself as well, because even though we have Black women, it's Black African women.
Yeah, absolutely.
Yeah. So for me now, it's like, where are the Black Caribbean women?
Yes, that's another segment.
So even though I'm coming into the group and I'm part of being around black women, we still have differences in culture.
Absolutely.
We still have differences in in how we've grown up and everything. So
true.
it's still good for me, but then it's still lonely, if you get where I'm coming from, because then I'm still not relating to some things.
Yes.
That you would probably relate to everybody else in the group. So we still so as you said, the stigma is still killing.
It's still there.
So even as a Caribbean woman, it's like it's still lonely because we're the other Caribbean women.
Exactly.
So
it's really interesting. It's like when we look at policies, and then you have NHS policies that say, oh, it is this word BAME policy, Black Africans. They group all of us together. We're all different.
Exactly.
Right?
Yeah.
West Africa alone. I am from West Africa. You're from Southeastern Africa.
That's different.
Different cultures. Everything we do are different.
Exactly.
So sometimes it's really, really hard. So I guess having women coming together and building their own communities is so important. But all I will say to people who are listening out there, please, 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 you need to read and understand about HIV. Because HIV is no longer that infection that we need to stigmatize.
It's funny that you say that, Jara. So this week I was on Instagram and I saw somebody put up a post to say that so it was a nail technician doing somebody's nails, and they were saying, they didn't show the face or anything, and they were saying this client was turned away from another nail technician because they are HIV positive. And they were saying that it's discrimination and everything. But what surprised me was the comments, because when these things go up on social media, you have to look at the comments. So when I looked at the comments, it was shocking. I can't believe in 2025 we're still that. They were saying, most people were saying, obviously some people were saying, well, you don't need to disclose your HIV status to the nail technician or anyone. Because if you're on medication. Some other nail technicians were in there saying, well, if you're practicing the health and safety law. I'm like, what health and safety?
It's ridiculous.
You don't have to disclose. It's not about. So they're saying, once you're practicing the health and safety, you shouldn't be worried anyway. So why people are? And I'm like, oh my gosh. And then some people are saying that you should disclose it because you need to know and all of these things. And I'm like, wow. But it just puts you in a place to realize that whatever we're doing, it's important because we need to keep talking about it because people are actually thinking they have to sanitize the place and keep up to the health and safety regulations because somebody was saying, well, you need to treat everybody like they're HIV positive, and I'm like, that is so wrong.
So wrong.
Like, why would you do that? You don't need to do that.
No, I mean,
so there was a lot of stuff going on, and I says it's 2025.
Key message on that note: HIV is a manageable condition. You equals you.
Yeah.
Undetectable means untransmissible. Basically, what that means is anybody who is HIV positive on treatment, you cannot transmit the infection as long as you're on your medication and you are serofast, meaning your viral load, the virus level in your body is undetectable. You are as good as anybody who is HIV negative.
Yeah.
So people, we need to educate ourselves. You don't need to take extra precaution. It's universal precaution for everybody. If you're working in a nail salon, what do you need to do? You wear gloves, you use masks. And that's because you're using nail files. That's it. Nothing else. Exactly. That's for everybody. It's not just for somebody who's HIV positive. Again, we need to have
treat everybody as if they're HIV positive.
That's right. That's going back to the 90s.
That's why we're having these discussions, isn't it?
Exactly.
It is. It's so important. And I don't think people really understand. Globally, you've got over 38 million people who are living with HIV. Globally. And modern medicine allows them to have healthy relationships and fulfilling lives. Come on. I've got these two beautiful ladies here who are peer mentors.
Yeah, we're here.
You know,
We
it's
live in
important.
normal life.
Yeah, we live in normal lives. I think
Yeah.
people just need to educate themselves, but also ask questions as well.
Yeah.
And I think programs like this, that's
Yeah.
what it is for, actually, for people to ask those questions so we are able to answer them.
Yeah.
Yeah.
And to normalize talking about HIV so
Yes.
that people don't have to go around spreading myths.
Yeah.
Yeah.
Because
Yeah.
these stigmas are based on myth, aren't they?
Yeah.
Like saying you have to treat everybody as if they're HIV positive. Okay, if you do that, how are you going to treat them?
Yeah.
That means you're going to treat them
Yeah.
like you're afraid of them.
Yeah.
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 Which is not necessary.
Yeah.
No.
And I think because your program is out there, ladies, that there are people who are isolated in the communities feeling that there's something wrong with them, that this will, as you said, normalise it for them.
Yeah.
Yeah.
And that means that they can feel part of something, even
Yeah.
if they are in a community of one.
Absolutely.
They can sometimes
Yeah.
feel
That's right.
that isolated when they come to see us. So
Yeah.
Yeah.
Yeah. And you do see that in clinic quite a lot.
Yeah.
And I think the stigma attached to it is so bad to a point that when you give somebody their diagnosis, as clinicians, we're always thinking, okay, do you have a family? We need to talk to your partners. But you can see they're terrified. You can see
Yeah.
in their face thinking,
Yeah.
tell who?
Oh.
I
Yeah.
can't.
yeah, so true.
And that's just because of this thing, because all they think about is, oh my God, how do I manage that?
Yeah.
And I think today, one of the things that we're going to touch, and I'm hoping Adana is actually would be able to give us some information around that and talking points, and talking to both Chido and Yannick, who are experts. I call you two experts in this field, and that's true because you're living with it, you've lived with it, you know, you've wrote a book about it. So, in terms of relationship and disclosure, so clinicians were very quick. We always say, "Oh, it is legal for you to disclose," but do we even stop to think, how do we support our patients for them to be able to disclose safely?
Yeah.
Yeah.
That safe disclosure is so important. Being in the right
is.
environments, you know, right.
Making sure it's the right people
It's the
you're
right
sharing
people
with,
you're
yeah.
disclosing to.
Yeah.
Yeah.
And I always say to people, you've touched on it, Dana, it's not one size fits all.
No.
Right? You can have a patient who's easily able to disclose to a friend. Easily.
Yeah.
But you might have a patient who find it very difficult to disclose simply because
Absolutely.
all of us do have our perceptions.
Yeah.
Right?
Yeah.
You diagnose somebody with HIV or even with any STI, sexually transmitted infections. Everybody have their own perceptions.
Yeah.
Yeah.
You know,
Yeah.
diagnosed somebody recently with syphilis. The person did not believe. Heterosexual. He says, what? How did I get it? That's the first question.
Yeah.
Right? And this is syphilis. It's not HIV. It's treatable. Right? Yes, you can cure it, but you can always get reinfected with it.
Yeah.
Right.
And at the moment, we have a big issue with syphilis across
Yeah.
the board.
Wow.
Right? We're seeing, you know that, and we see
we do,
loads and loads of syphilis
Yeah.
positives in clinic.
Yeah.
And quite a lot of them are heterosexuals.
Yeah.
So we've gone past that era when people think it's only men who have sex with men do actually have infections.
Yeah.
Because that's what everybody's been taught to think about.
Yeah.
Yeah.
You know, a new guideline just came out a couple of days ago for doxypep, so doxycycline, to use it to prevent syphilis infection. It's a brand new guideline, and I was fuming. Because they excluded women with vaginas.
Oh.
Wow.
So everything is just for gay men.
Discrimination. Women are excluded again. I was fuming. Everybody in the clinic, I was absolutely fuming. Because when you look at the statistics right now for syphilis, heterosexuals, women, the amount of pregnant women we've treated recently
Wow.
Really.
with syphilis, because it is a pregnancy, it is a screening. When you're pregnant, you
Yeah.
will screen you for HIV and syphilis.
Yeah.
That's routine, right? The amount of women we are treating whilst they're pregnant with syphilis, and then a policy comes out to prevent syphilis, and then you exclude women
Who are the most vulnerable?
who are the most vulnerable, some of them cannot negotiate sex.
No.
Yeah.
Yeah.
Because their husbands are breadwinners, right?
Yeah.
So they cannot negotiate. They're just there. They provide everything. So they can go out, have sex with other people and come back, and then you're having sex with them. But what did we do? We exclude them.
It's ridiculous.
Yeah.
It's not.
Should we start a petition to
good.
review that policy?
Yeah.
Honestly, and again, you see this over and over again. And I think we really need to be thinking about our health policies if we want to be inclusive.
Absolutely.
Yes.
Okay, inclusivity means men, women, children across the spectrum, everybody, and no wonder why when you see Black African, Black Caribbeans go into clinics, or some of them will not even go to clinics because of the way they're treated. So we have that trauma. So we have a trauma because we never have good experiences with healthcare anyway to start with. Then you get diagnosed with an STI, something like HIV. Then you go in, you're talking to somebody, and they don't actually understand your social economical issues, which is very important. And I think sometimes we ignore that. Right? An asylum seeker who's a mother, how much do they give them a week? Not a lot.
Yeah, not much.
Right? You expect them to come to clinic every day. Well, where are our clinics? I have to take 2 or 3 buses to get to the clinic. But yet still we say we're accessible. Are we really?
No.
We're not.
No.
No.
Absolutely.
We're not.
Absolutely.
Right, let's talk about disclosure. Since today we're going to be talking about disclosure. That's the on my soapbox because, Right, ladies, how did you come about disclosing your diagnosis? Who wants to take this one first? And how you felt? I like how she's wrote a book about it.
Come on.
Well, for me, at first it was hard. Well, at the time when I was diagnosed, I was just engaged to get married. So when the nurse told me that I was HIV positive, and she said, would you like to tell the person that you're with, or should we? And I was like, you, because I don't know how to say that I'm HIV positive. So the first person that knew about it was obviously my husband to be at the time, so I couldn't disclose it to them. But then I find that and then I told another friend after that was very close to me at the time, and it wasn't easy. It was one of the hardest things that I had to do. But again, because I know them and I know what they're like, so it was easy to tell. So I think for me, in the first year of telling, about probably 5 people on my hand was people who I knew I could really, really trust. And so that's what I did. And then over the years now, it's just gotten easier and easier because I've gotten to terms with it. Obviously, I've learned more about it. And it's just gotten easy. So I think if you start off with the people that you trust and how they respond to you, I think it gets easier for you to do it, because then you realize that you haven't got any nobody has treated you anyway, or there hasn't been any discomfort around you when you've done it. So it gets easier to tell other people around you. So when I did it openly is when I finally did it openly, where I told everybody about it. I think I just had one thing happened where I had a friend that I normally look after her daughter, and I think her dad must have got upset and was saying, why didn't you protect her? And at first I was feeling a way about it, and then after that I was like, no, it's just ignorance, because obviously I'd reach a place now where it's like I understand when people get ignorant now and they do certain things, or if because I know it's just out of ignorance, out of them not knowing about it, and so after a while, but it's okay now, because it's not like they stop it or anything now, but at first with what they said, it was a bit like, But I haven't gotten, I can notice some people difference how they kind of act, because I don't think sometimes people know how they behave in their action and how you can see their face or how they deal with it after they've known about it. But you can obviously see it, the changes with some people, not everybody. So, you know, but I just know that they just need to be educated. And this is why I'm so drawn to do the show or to be on a platform where I can talk about it more so that people are more educated about it. Because I feel like the more you know about it, the better you are in dealing with people, or when you hear about it, you respond.
Yeah.
It's going to be different. So, yeah, that was for me.
Yeah. How's your dating journey? You know?
Yeah, mine is a little bit complicated. Well, obviously I've shared before about how I first disclosed to my husband at the time.
Yeah.
So I don't need to go through that again, do I? Yeah, okay. So
I think in general it's about your friends and I think I always think about families to start with. You know, for example, if you're going to go into a new relationship and because I find that patients will always say to me, well, I don't want to say disclose to somebody and then I get disappointed. Because I remember a patient saying to me, when I did it, it felt as if that was the day I received my diagnosis. Because it was that rejection, isn't it? You know, how people would just reject you. And usually I'll say to people, well, before you start to even get feelings, you know, having the strong sexual feeling with somebody or thinking, oh, maybe I might love this person or whatever, just test the waters a little bit. Have a common conversation around STIs.
See how they think about it.
That's what I was thinking. You know, if I meet somebody, I'm not going to wait. I'm just going to come straight forward. But that's just me.
Yeah, that's right.
I would just be like, look, I'm living with HIV. Let me just let you know that from now. So, and do you know anything about it?
Yes.
Blah, blah, blah. Is there questions you want to ask? But that's just me. And I know it's going to be difficult for other people. But I think it's better that way.
Yeah.
Because once you get emotionally involved with somebody, start dating and you get into like them more and you started to connect, it's going to be hard.
It's going to be really hard,
Especially when you tell them and then they'll be like, oh, no, I don't want to know you.
And you're already invested.
So I think for me, it would just be like straight off, first date, bam.
And that's where the rejection comes in, isn't it?
And
then, you know, from a psychological point of view, everything just comes back flooding. Because... it just takes you back to where you started from, and I think it's that fear that people do have. And I always say to people, you know, it's so important that we do educate people. You know, but first of all, I say educate yourself. Understand your diagnosis so that when you're talking to people, you're able to explain it to them very well, because you are the educator. Because you're going to meet people who don't have any understanding of it at all. At all. Donna, with all the patients you see in clinic, do you just want to talk through some psychological challenges you think some patients do experience when dating, or you know, for them to meet new people or navigating families?
I can. It's going to get a little bit heavy. Is that okay? Because, you know, this is going to touch on things that it will get heavy. Because obviously how someone contracts the virus is important there, particularly around women and for men as well, obviously. But here we're talking about women, and the circumstances around that can lead to trauma. Because obviously some people, it could be through sexual violence, it could be through relationships, in the previous relationships. So that's where in psychology we're working at a very deep level to look at those issues, because sharing your story, as you've said, is very, very important for many people, but other people, they can't even face that story. It's just so painful to think about the circumstances around the diagnosis. So we have to work with that in clinic to try to help people to be able to process those memories, which can be traumatic. So for some people, if they've got that, we would really need to be doing a course of therapy around that in the clinic. So we're talking about and I'm not saying that's every woman that's diagnosed with HIV, obviously, but for some, that's really, really profound, and that's why they can't even face that part of the diagnosis to be able to move forward with it. So we have to do a lot of hard work in the clinic around that. So we're looking at things like sexual violence, rape, lots of other really profound issues for women there. But aside from that, everyone's story, like we said, is different. And listening to Yannick there, talking about your story, Yannick, one thing is, do you feel having a strong core in yourself, your self-esteem being quite strong when you share that information with your family and people close to you? Do you think it's important that you feel strong initially before you share that with others?
Yeah, I think you have to come to terms with it.
Yeah.
Because it's almost like preparing yourself in case somebody says something that's damaging.
Yeah.
So it's like almost going in with your armor to say, you know, I'm prepared. So you have to be able to deal with it, have that education to be like, or even if you don't say anything, it's just to understand where that person is at.
Yes.
And just knowing that they're just ignorant. They just don't know the full information about these things. So you can actually have empathy for them then. Yeah. You know, just to know that, I know where you're coming from. Because you have to put yourself in people's shoe, and I have to think that not because I have this information, because the reason why I have this information is because I am in the situation.
Yeah.
So I have to think, if that was me, would I be doing the same thing? Yeah. Because I wouldn't have had that information. Yeah. So it's just things like that, you know, just knowing that it's not their fault. Yeah. It's not that, you know, because if you don't know, you just don't know. Yeah. And some people have never heard of HIV or AIDS.
Yeah. So true.
Not even HIV. They haven't, you know, all people know is AIDS.
AIDS, yeah.
Yeah, so when you come now and say to them, that will probably be the first time they've heard about it. Yeah. From the 80s or the 90s. Yeah. So it's probably something that has never been spoken about since then. And so when you're coming now to them to say something to them, that's probably the first time they've heard about it personally in their face, knowing somebody right at their doorstep saying these things. Yeah. So, I think you have to be the one that's telling it, have to be in a certain place to deal with the response of other people.
Yeah. And I think for us, like Jara, the support networks around people, like you've said, Jenny, having just a core of friends or family that you can tell and trust, because trust is one of the biggies when it comes to people.
It is, and absolutely. And you touch on sexual violence, and we work with women sometimes who, because they've gone in and disclosed their status, domestic abuse becomes part of their realities of life. But yet again, it comes back to the same thing, lack of education. So it's okay for us to say women need to be educated, but we need to be educating our men.
Yes, definitely.
You know, the men needs to understand, and they need to have that knowledge to know. It is important that somebody who's been diagnosed with anything, HIV included, you know, yes, that woman is the first person to be diagnosed, but hang on a minute, you could have been the source of the infection. Yeah. You know, and we've seen that in clinic. But unfortunately, the person that gets diagnosed first usually tends to pick the brunt of it. And you do see the mental health of these women. Honestly, the psychological impact it has, you know, it's so much to a point that they don't attend their appointments because physically and mentally they can't.
Just heavy.
It's so heavy that they cannot get themselves out of bed to say, I've got to go to a clinic. Despite the fact that all the clinics, you don't even know that they're HIV clinics because they're all generic clinics. But it's just because of the mental toll and that perception and the stigma attached to it from the community is making these women feel this way. You know, so when we're educating, I always say we need to educate across the board. We need to educate our communities. We need to educate our men because most of the time, if you take the African context, right?
Yeah.
Most of the African women that we see, their HIV source was either sexual violence, and quite a lot of them would come from a war-torn country, because we do know war, what do? They use women. Rape becomes one of the most, rampant acts that soldiers tend to do, carry out. And most of these women, that's how they actually contracted the HIV. So we're not actually looking at the person or what happened to the person. We're already judging people.
Absolutely.
So the community education and having these conversations in our lounges are so important. I cannot stress it enough. Our boys are growing up with no knowledge, because they're not educated around sexually transmitted infections. All they know is everything they hear from their friends, from their aunties. And I say the same thing about mental health, right? From an African Caribbean context, mental health is seen as a derogatory word. People don't want to talk about it. It's kind of like another stigma being attached to mental health. So how can we have our children come to us as parents if we're sitting with the children and when we talk about mental health, it's all negative, they will never come to us.
No.
So by the time they are getting support, it's too late. So that's why if you look at the mental health statistics for Black people, again, the trends are so bad. Then you beg the question, why is it always us? It's because by the time we get help, it's late.
Too late.
It's late,
And that's because of the stigma we've attached to quite a lot of these issues. So I'm hoping that people who are out there listening, please do share this talk. And after this, you can access it on YouTube. Share it so that people can listen to it and ask questions. Because I'm telling you, stigma is killing us. From a physical health perspective and also from a mental health point of view. It is absolutely killing our communities.
It is.
Yes.
Should we go for a break?
Yes.
I think it's the right point to go for a break.
Go for a break.
We will be right back.
Yes, guys. See you in a bit, guys.
Life is like a big merry-go-round. You're up and then down, going in circles, trying to get to where you are. Everybody's been counting you out, but where are they now? Sitting in the same old place, just faces in the crowd. We all make mistakes. You might fall on your face, but you gotta get out. I'd rather stand tall than live on my knees, 'cause I am a conqueror, and I'm only 73. Try telling me no. One thing about me is I am a conqueror. I am a conqueror. Got a vision that no one else sees. A lot of dirty work, roll up your sleeves. Remember, there's a war out there, so come prepared to fight. You never know where the road leads you. Not everyone's gonna believe you. And even though they're wrong, don't prove it right. I'd rather stand tall. Than live on my knees. Can't live on my knees. 'Cause I am a conqueror, and I'm only 73. Try telling me no.
Hey, we are back. We're back. So this is the HIV Positive Show, and today we're talking about living positively. HIV, relationships, disclosure, and mental health. Ladies, how are you feeling?
Yeah.
Oh,
Feeling
good.
good.
Yeah, go good.
Yeah. Right. So on this segment, I just want to touch on HIV facts and relationships. So, HIV positive people must only date other HIV positive people. True or false, ladies?
Definitely
False.
false.
This has actually colored my experience a little bit.
Okay.
Like after my first husband passed on, I never actually disclosed to a lot of people because when I told my mother, she kind of probably told one person and then you know how it goes. So in the end, I ended up thinking everybody knows about this. So I ended up finding myself being introduced to people who were also HIV positive. So this was like people telling me that you should only date from this pool. Which is just wrong. It's not necessary. Yeah. And it is false.
Okay, so the other question is, condoms are always necessary in HIV positive relationships. Is this true or false?
Well, it depends on treatment, whether the person is on treatment. If you're on treatment, adhering to your treatment, your viral load is undetectable, then it's not necessary to use condoms unless you're protecting yourself from other STIs, which can actually be worse than HIV.
Absolutely, you hit the nail on the head. So,
Yes.
condom use, because I remember somebody saying to me, oh, actually, now people don't talk about condom use. Well, we do talk about condom use in clinics because it does prevent not only HIV, or the sexually transmitted infections.
Yeah.
So when we talk about PrEP, which is your pre-exposure prophylaxis, the medication that you take to prevent you from acquiring HIV, that's okay because that's a tablet. It will only prevent you from getting HIV, but it does not prevent you from picking up gonorrhea, chlamydia, syphilis, hepatitis C, hepatitis B. Right?
Yeah.
So these are all infections that are out there. Whether you're HIV positive or not, if you are not in a monogamous relationship, and when I mean monogamous is when you've got you and
One
your partner are in a relationship and nobody else, right? But even within the 3 months of that relationship, you've also gone and get tested together, knowing that both of you are negative. None of you are bringing in any infection into the relationship.
Yeah.
And this is very important.
Yeah.
Right?
Yeah.
Because people can start a relationship, they don't test. Forgetting that everybody's an adult, they've had prior relationships.
Yeah.
Okay. And people will bring in infections into relationships. So it's so important that you make sure before you have condomless sex with your new partner, you are testing
For everything.
and make sure you're covering something we call the window period because every infection has window period. Okay. So your bacterial ones, which is your gonorrhea, your chlamydias, is 2 weeks. So syphilis is 3 months and you have HIV, which is 45 days. Okay.
Right.
If you're listening, this is very, very important message. It's a very important take-home message. Make sure you're testing for at when you change a partner. Every partner change, test.
Yeah.
We've talked about this in the last show.
Yeah.
Testing is prevention.
Yeah, it is.
So it's really important. We cannot stress condom use. Yeah, Chido, you touched on it. Using condoms with somebody when you're HIV positive, it all depends on what your viral load is. Because we talked about U equals U. So we know quite a lot of people who live with HIV have undetectable viral load because the medications work magics these days. You start on meds. Within 6 months, you've got complete, serofast, your viral load is undetectable. Right?
Yeah.
In a monogamous relationship, you do not need to use a condom, just like any other relationship. However, if you are not in a monogamous relationship, please do use condoms.
Yeah.
It's important.
Or if you're not sure.
If you're not sure, that's right.
Yeah.
If you're not sure, okay?
Yeah.
But also remember, you've got PrEP. You can access PrEP in all the clinics, okay? Donna works in Wolverhampton and Warsaw, so you can go to any of the sexual health clinics and you can ask for HIV PrEP.
Yeah.
Right.
Birmingham and Solihull, you've got Umbrella Sexual Health. You can get yourself a home test kit to test, or you can walk into any of the clinics.
Yeah.
Right, ladies. Donna, can you just talk through some emotional toll of misunderstanding and how education does help boost patients' confidence?
Yeah. I think the main issue for me is the stigma and the self-stigma that goes with that. That people can take those messages, internalise them. So we have to work with stigma first. That's a big issue. And education, I think, programs like this. You're sharing, aren't you? You're sharing from a very personal place, and also with clinical advice as well. Going to your sexual health clinic, speaking to your clinical nurse specialist, speaking to your consultants if you have questions about HIV, and if you have mental health related issues, coming to see someone like me in the clinic, and in confidence, and knowing that you can share your information in that space, and you can do that in confidence, but encouraging other people to do that as well. If you are more open about your status, to encourage other people, but obviously encouraging people to do it, but in a very protected way, not just obviously sharing it with anyone. This is personal health information we're talking about. So I wouldn't just be saying to someone in a clinic, go out and just share this with the world, unless you really want to. And then when you are at that place, then go out there and spread that message about busting some of these myths that you're talking about tonight. Really, that's what's needed. What Yannick said earlier about the nail clinic, it never ceases to amaze me. It never ceases to amaze me. So the emotional toll of it, people can become very depressed, and we lose people to clinic then if we're not careful, and adherence to their medication if they become depressed. So we need to be working to ensure people feel that they can work with depression, they understand and they get treated and supported with depression. That's one of the biggies. Of people diagnosed with HIV, 28% of people are diagnosed with depression. So it's the big one. Anxiety's in there, sleep disorders, PTSD, coming to terms with trauma around that. Eating disorders as well. I don't know whether you find that in the clinic, Jara. Eating disorders.
They tend to go off. Some of them will go off their food, but then you see that with depression, isn't it? So usually depression, some of the symptoms of depression is they go off their food. They will not get out of their bed. They lose every inability to do anything for themselves.
It's hard.
Some of these women have children, so they just know that, okay, I've got to get up, I've got to take my child to school, and then that's just that routine. So it becomes very mechanical. And that's all they do. But deep down, they're dying. Because when somebody's that depressed, they cannot, they don't have any inability to do anything for themselves. And that's the thing. But it's so important that us as clinicians to give people time to talk. And we all have sixth sense as clinicians. You will see somebody, you will know definitely something is not right. Straight away you can pick it up.
Absolutely. The referrals into psychology often come from the clinical nurse specialist in the clinic who knows the patient well. And then, like Jara, and we have Gaynor and Steph at Wolverhampton, they will refer across to psychology then for the support.
And you can pick it up, and sometimes they're like, oh, no, I'm okay. But, I always say it's giving that person time to build trust. Trust and respect is so important as a clinician for you to be able to understand your patient, but most importantly for that patient to be able to come to you and tell you, I'm struggling. And that's why the psychology team comes in. I always say it, within our service, we cannot do without our psychologist. And the amount of cases we see, and this is not only HIV positive patients, this is across the spectrum. I was saying the other day, I said, I don't know what's happened post-COVID. Every case you pick up is complex. And all those complexities are to do with mental health.
They are.
Lots of anxieties within our young people. Very much so, whether they're diagnosed with HIV, whether they're diagnosed with any other sexual health infections. But some of them just come to clinic for help. Because they can't get to their GPs. At the end of their 30s, they're thinking, okay, let me just go into a walk-in clinic. And what happens next? We have a responsibility, and you can see it. It's very clear. I don't think there is a week where my team has not contacted the mental health team, or haven't taken somebody to think, actually, we're going to call the ambulance because they've got suicidal ideations.
Wow.
And of course, that's another issue, isn't it? Suicides, you've just touched on, Jara.
Yeah. So on that note, NHS 111, if you have any mental health disorders or you feel distressed, because obviously some of the topics we're talking about today will be distressful around mental health, sexual violence. For mental health, NHS 111 now do have a mental health section, which is brilliant. Great. So you can just call NHS 111 and ask for mental health support, and they will put you through to a mental health team. You can also call Mind Support line, which is 0300 102 1234. You can contact Samaritans 24 hours a day, 365 days a week. You can call free phone number 116 123.
Yeah. And obviously for anyone that's abroad, not in the UK, just finding out where your
local services
are. Just want to send a shout out to everyone listening online. Thanks, guys, for just listening in. Just want to see if anyone asks any question. Ariel is saying knowledge is so empowering. And then Sonia is saying thank you, lady. Audrey,
that's my little sister.
Yeah, she's saying hello, ladies. I'm late, but here now. So welcome, guys. Thanks so much. Don't forget, guys, you can leave a question on the chat. If you have any questions or you want to contribute to what we're saying, go onto the chat online. Don't forget to follow us on Instagram, the HIV Positive Show, YouTube at HIV Positive Show. Yes, guys, subscribe and listen to the show. And share. So while you're listening in, just find us on Instagram, HIV Positive Show, and go on, give us a follow and let us know. And so if anything, and you don't want to put your name on the chat to let us know who's talking, that's fine. You can change your name. You can put it anonymously and ask the questions, because we do understand. We don't need to know who is asking the question or who is saying hi. But get involved, guys. Interact. We're here. We've got 2 experts on today, so come on, ask the questions. Yeah, over to you, Jara.
So I'm hoping that we get some questions from the audience. Is there any questions from the audience?
Well, I can't see any online at the moment.
Okay. So whilst we're hoping to get that, let's go through some HIV statistics. Every show, I'm going to touch on some statistics because I think it's really important for people to understand how many people in the world are living with HIV. I talked about 38,000. It's actually, as of 2023, estimated 39.9 million people worldwide are living with HIV. New HIV diagnosis in 2023, approximately 1.3 million people acquired HIV, marking it as 39% decrease since 2010. Oh. Do you know why we have this decrease?
Because of medication?
Yeah.
Right.
Okay. So it comes back, and I think this is really important, guys. It comes back to what we talk about, being on medication. Yeah. Because we know if you're on medication, your viral load is going to be undetectable.
Yes.
Okay. So what happens then? You are not transmitting the infection.
It stops with you.
That's right. Right. And you live a healthy life. Yes, you have to be on drugs for life. However, how many other diseases do we have that we have to be on medication for life?
Exactly.
Yes.
Right.
Yeah.
I take vitamin D every day. I have to take it because if I don't, I can't get out of my bed.
For life.
That's right. I have to take it for life. So I guess we need to look at this in the bigger picture. So, for example, when I talk about PrEP, and it's rather sad because when I talk to heterosexual patients who I know they've acquired other sexually transmitted infections, or some of them, lucky so far, have not acquired anything, but because you can see from the sexual history, they have multiple partners, the risk is there. But when you talk about PrEP, you say, why should I be taking medication forever? Well, guys, we prevent, don't we?
Yeah.
As human beings, what do? We want to prevent ourselves. People will take statin because they don't want to have high cholesterol. People take high blood pressure medication because they want their blood pressures to be low.
Yep.
You go and exercise. Why is that? Because you want to be healthy, to reduce your weight, because we do know if you've got weight, obesity is linked to other, diseases.
Yeah.
So it's all prevention. So
Yeah.
if there is this medication that's there for you, why not take it?
Yeah, might as well take it.
That's it.
Just take it. And if you look at the GBMSM's diagnosis, men who have sex with men, bisexuals, their HIV diagnosis rate, if you look at the trend, it's actually downward trend,
Yeah, it's going down.
right?
Yeah.
Heterosexuals, we are like upward trend.
Going up,
So it's got
yeah.
opposite direction.
Yeah.
But the reason for this is because they are on PrEP. So why are we not going for PrEP?
It's like they're more aware of what
Their
they need to do.
sexual
Knowledge.
Yeah.
Again, knowledge.
Yeah, knowledge.
Knowledge is so
Yeah.
empowering.
It is, yeah.
Yeah, because heterosexual people actually act like they don't have sex.
Exactly.
I don't know why.
But they do every day.
We actually act like we don't have sex, and I don't know why.
Yeah.
But,
Taboo, isn't it?
It is.
It
And
is.
again, I think, it's around the education piece,
Yes.
isn't it? Because
Yeah.
people are not educated yet again. I'm sorry, men, if you're out there listening to me. I know I'm talking about women, but also I can't forget the men. We have to educate our men.
Yeah, we do.
Because the responsibility lies in both.
Yeah.
We know this. We know that if you look at Donna, you've already said this, that most of the patients you work with who are diagnosed with HIV are African women, right? What does that say?
yeah.
But then culturally, when you think about how Africa is, right?
Yeah.
You then think, okay, why is it that African women are most diagnosed with HIV?
Where the
That's a
men-
question we need to ask, and this
Yeah.
is valid
Yeah.
questions that we need to ask.
It is, yeah.
And then you're thinking, hang on a minute. Africa is one of those countries where you have to get married. Yeah.
Yeah.
Before you talk about having sex outside of marriage. And there's a lot of issues culturally around it. That freedom that we have here, we don't have that in Africa.
No.
But yet still, African women are the most diagnosed with HIV than anybody else.
Yeah.
Yeah.
Even the unmarried ones.
Yes, that's my point.
Yeah.
Yeah.
So what does that say? Why are we leaving the men out there?
Yeah.
One, we know that men don't
Absolutely.
test anyway.
Yeah.
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 They don't test. So the women are the ones that actually tend to get tested.
Yeah.
Right?
They are.
This is really sad. I had a patient that one of the clinicians asked me to see. Okay. It's been in this relationship but years and years ago. So she then moved here from a country in Africa. She's here. They all moved on. But they never divorced.
Right.
Okay. He couldn't come to to wherever European country they say where they live in. So she carried on with her life. She have another child here. So all of a sudden, this guy happened to have a visa to come to to meet this woman. Family then said to her, "Sorry, he's still your husband."
Wow.
Okay. She is worried sick.
Yeah.
Because rumors already said the partner back home died of HIV.
Oh, no.
The female partner. Honestly. This woman, when I saw the woman, he said, I don't know what to do.
Shame.
Yeah.
So we had to start out on PrEP.
That's
Yeah.
good.
Yeah.
Yeah.
So, and even with that PrEP, we had to actually really break it down. I said, well, actually, if he's forcing you to have sex, that's rape. He said, but he's my
Yeah.
husband.
Yeah.
I cannot say no. Well, technically, he's not your husband.
Yeah.
You've all gone away for a long time. You've had a child for somebody else. You're living with that. You were living with that person. Now, because culturally, your cultural African traditional marriage they never annulled it. So now the family is saying he is your husband. You have to live together.
No, you don't.
Now he's your husband.
Yes.
Yeah.
And it doesn't
it's
matter
just
how I
so bad.
explain. She didn't get it.
Yeah. Because it's ingrained in her that
she said, I have to have sex with him
Yeah.
because he's my husband.
Yeah.
Wow.
But at the same time, she knows there's a possibility that he could be HIV positive.
Yeah. But she still has to do it.
Yeah.
She thinks she
Yeah.
has to.
Yeah.
So, somebody anonymous says, I met someone over a year ago and we both had a strong attraction, went on dates, and he wanted to move the relationship forward. I found out he's HIV positive from someone, but he never told me. So we never went further. Thing is, I'm upset he didn't tell me. We never were intimate, but I wish he disclosed because I would have been okay with it. So that's from somebody anonymously.
Thank you.
Thank you for
so
sharing.
much for sharing.
Thank you for sharing.
Thank you so
Yeah,
much.
and that's really powerful. You're absolutely right.
Yeah.
But again, people are so afraid of the stigma and the rejection. That's why they don't say it. But then there you go.
Yeah.
You know, she would have understood.
Yeah.
Because she's got the knowledge.
She does, yeah.
Yeah.
She's got the power.
Yeah.
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 And that person obviously didn't know.
That's right.
Yeah.
And then now, you know, a
Yes.
very good relationship you could have had, you've actually lost that.
Yeah.
All
Yeah.
because of the stigma that we've attached to
Yeah.
HIV. It's really, really
hard,
sad.
isn't
it?
It's
Yeah.
hard.
See,
And I know they say you never went further. Was it because you found out and said something to him, or, you know, let us know.
yeah.
Because he said, you know, you found out because somebody else told you, because they never did. But was it when you confronted him that's why you didn't go any further, or you know, or you
She
just
not confront him at all.
or didn't you confront him, or just left it there and just didn't talk to him anymore? So, and we understand why you would get upset, because it's obviously, if you like that person, you would think, why didn't you trust me to say?
Yeah.
But then this is what I'm saying. We have to put ourselves in people's shoes,
Yeah.
because you have to think about them as well, and the fact that they could be scared,
Yeah.
and they could be in a place where they haven't dealt with it, so they wouldn't know even how to begin to say, I'm living with HIV, because of the stigma around it. So while we can get upset and make things about us at the time to say, oh, you know, you could have trusted me or whatever, but you have to think about where that person is at mentally with the diagnosis.
Which is so important. Understanding your diagnosis and being able to manage the conversation. It's important. And I always will say to everybody that I diagnose, I say to them, you need to actually understand first before you start to talk to people.
Absolutely.
Oh, they said, no,
Absolutely.
I've never said anything to him. Still waiting for him to tell me, since he's still asking me to be in a relationship with him.
Right.
But probably open up the question, or even say to him, I know and I'm okay, just to let you know. You know, just to let you know, I'm okay with it. It's okay to share with me. I'm not sure where you're at with it at the moment, but I'm just letting you know that I'm okay with it, because I'm fully aware and I'm fully, understand or have the knowledge when it comes to HIV, because they say it would have been a long distance relationship. Okay. Probably it's just you opening the floor and opening up that and just saying to him, look, I know
and I understand,
and I understand.
Or you can put it in another way and say, look, you know, all of us before this have had relationships before. How do you feel if we go and test? Because obviously it is important. And by the way, for me, it doesn't matter. I'm only asking for testing so that you know what my status is and I know what your status is. And regardless of what the result is, how I feel about you will not change. I think that's a good way of approaching it.
It is.
Yes, actually, Francisca says, hello, ladies. Thank you for the great show.
Oh, that's my sister
Thanks,
again.
Francisca.
I got many sisters.
You got
typical African family.
You know, I was just about to say, speaking of putting it the way you said, Jara, I've got a friend who, she's very conscious about HIV and stuff, and I'm like her expert. She comes to me with all the questions. So she keeps home HIV test kits for, like, if she's dating somebody
can get them tested.
So she had this one guy who would not test. Like, they were together. She brought out 2 tests. She said, this one's for you, this one's for me. I'm going to do mine now. Then the guy was like, no, I'm just going to take it home. The guy procrastinated like forever. He never took the test. And I say to her, it's one of 2 things. Either he's positive and he knows it and is afraid to tell you, or he knows he's slept, or maybe he's encountered somebody who is positive and is afraid to test because he thinks he might be positive. So that's a
good point. So we do have patients who will never test for HIV.
Wow.
It doesn't matter how much you've actually sat down and spoken to them. So usually if somebody comes in, everybody we will offer standard tests. You have all the standard tests, including HIV, right? But you do have patients that will say point blank, I'm not going to test.
Wow.
So usually that's when somebody like myself, they will refer the person to me so I can just sit down and have a good understanding from the psychological point of view, really, where they're coming from. Because, again, we talk about perception, and some of them is just lack of understanding. But when I break it down and explain the benefits of testing,
Right.
majority of them will test.
Okay.
Yeah, but it's just that knowledge, because they have, all they hear about it is negative, negative, negative.
Yeah.
So they've already hold on to that negative connotation, because they're thinking, if this test becomes positive, that's it, I'm done. Right?
Yeah.
So they hold on to that. And this is why when we started, and every show I always bang on about, stigma is killing us.
It is. Yeah.
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 The stigma is killing us, because you get a test done. If you are positive, you know you're going to be sorted out. You will be on medication for life, and you will be well.
Yeah.
Right? But if you're not tested, what happens? You don't know. By the time you know, you're so
really-
sick, you end up in ITU.
Yeah.
Right?
Yeah.
So you're fighting for your life, when actually it is preventable.
Yeah.
Yeah. But this is why these conversations are so important. We need to normalize it, so that people can take away those stigma and those fear away from it.
Yeah.
But if we don't normalize it, it's just going to be such a problem. And when you look at nowadays in the UK, you never hear sexual violence on the TV.
No.
Now all you hear, everybody reports sexual violence. This is why you can see the data, the trend of reporting has gone up, because it's become normalized conversation.
Yeah.
Because people don't used to report it because they're out of shame.
Yeah.
Yeah.
Do you get it?
Yeah.
But once you start to talk about it, and then you normalize it, and then you will see. And nowadays, the internet is so powerful.
Yeah.
And this is why I always say to anybody who is an African or Caribbean person, who is a celebrity, right? You need to give something back.
Yeah.
Yeah. You
And what you need to give back is going into clinics, getting tested, people that follow you, seeing you doing that.
Yeah.
We're thinking, oh, actually, yeah, that's cool.
It's cool to do.
Yeah.
Yeah.
You know,
Yeah.
and that's the space that we need to be in.
Yeah.
Yeah.
But we're not there yet.
So they're
Yeah.
still saying something. So Anonymous, the thing is, he was extremely pushy and trying to be intimate, but I said no. Then I later heard about his status, not from him. So it can it can be challenging like that.
Yeah.
But one thing though, if he's on medication,
That's right.
that's why he's probably don't think
Wanting
he
to-
needs to share his status. So you can think about that as well too. And normally, if somebody's on medication and they're undetectable, and they know that they're not causing you any harm anyway,
Yeah.
so they don't necessarily need to share that.
Yeah.
So yeah. I think sometimes it's a trust thing,
It is.
Yeah.
Yeah.
and people knowing how you're going to deal with it. So
Yeah.
it's probably having to just wait till a situation where you can actually have a conversation like that around that kind of topic,
Yeah.
for them to see how you deal with it, how you respond to it, or things like that, and then they probably can feel more comfortable sharing it.
Yeah.
Yeah.
Or as I said, just ask the question and just start the
And see what you get.
conversation and
Yeah,
see
see
where
where
it
it goes.
goes.
Yeah. Yeah.
Yeah. I wonder if
let's say thanks
if
for showing
Donna-
it from that angle.
Yeah. I wonder if you've encountered any such cases, Donna, where somebody doesn't want to disclose. How would you handle that one?
Where someone doesn't want to
Like
disclose.
In a
this-
relationship,
in a
yeah.
Relationship,
like in this
yeah.
sort of scenario.
we see it quite often.
Yeah.
In all fairness, again, it's difficult to say. Like I said, one size doesn't fit all.
Yeah.
However, it is about working up to it for people.
Yeah.
So they might, like you said already, want to introduce it somehow into the conversation. It depends. I've known people who have become very intimate with people. They've got married and still feel
told.
unable to, say, disclose their status.
Yeah.
So again, the person themselves is you equals you. You know,
Yes,
yeah,
absolutely.
detectable
Yeah.
and transmittable.
Yeah.
So that's
Yeah.
okay. I mean,
Yeah.
but it is about building up that trust, and that can take time. And if someone's self-esteem as well, working on their confidence, working on their self-esteem,
Yeah.
working with other people. So being part of a group sometimes allows people to have those conversations and ask other people,
how did you do it?
Yeah. You know, and if there are other issues there, it could be previous relationships. They're worried about rejection. Yeah. That's a big one.
Yeah.
You know, people are so worried about feeling rejected by the person they love. Yeah. So they will keep that to themselves. So it's a difficult one, actually, in all fairness, and I don't think there's an easy answer to it. I'm going to be honest.
It's still, because remember, you know, as well too, people who are living with HIV, they still have stigma.
Internalized stigma.
Internalized.
They still have internalized stigma, so they are still at a certain place where they're thinking it's horrible. This is, I do not want to share this with anyone, because I remember thinking that was it for me. Nobody's gonna want me. Blah blah blah. You're thinking, you know, you're gonna be this dirty person. Nobody's gonna love you or even be attracted to you or whatever. So it's actually the person. So I think if you can build up that space where they feel comfortable. Do you know anybody or any friends or any family that's HIV positive as well? You probably could share with them that you know somebody who is, and you know, sort of find ways to bring up the conversation, and probably share that, you know, I know somebody living with, and you know, whatever, however it can come up, and things like that. So you know, I mean, you don't have to call names to people, but you can, you know, try and find ways to talk about it. So the person knows that they can trust you.
Absolutely.
And it's not going to be something that you're going to be saying to anybody else. Otherwise, from, you know, they knowing that it's just you that I've shared it with.
Confidentiality.
So, yeah.
And the other person might be living with a misconception, as you've said. They may think AIDS. You know, they may have those messages from the 80s still in their head, you know.
Messages.
Messages. And they may be really worried about that. So educating and making people aware that we're talking about very different things here, aren't we, really? And educating the other person around that is part of it, and maybe too.
And, you know, I know you're anonymous, I'm not sure, and you said long distance, so I'm guessing the person is in a different country. It could be where they're from, where they're living as well. We're not sure how high the stigma is in the country that they're living in as well. So there's a lot of factors around why people don't share.
There is.
So I think it's just creating that space between you and that person so that they feel comfortable to share it with you. Aminata? Very educative, they say. You know that person too, Cheetah?
No.
Because he went,
No, not this one.
Okay. So that's a very interesting one, which is something that happens.
You see, as a health advisor, throughout my career, disclosures, whether it doesn't matter what it is, it's very tough. Very tough, and all of us will disclose different things at different times. Sometimes we do drip drops, sometimes we do, but I always say to people, so usually what I will say to patients, I will say, look, you need to understand what you're dealing with first. Get the knowledge. Okay. So that when you're ready to speak to somebody, even if it's your family member, what you need to remember is you're educating them.
True.
Okay. And don't be surprised if you get a reaction, kind of like a rejection from them. They're not rejecting you. It's because they don't have the knowledge. So I tend to prepare them. You know, they don't have the knowledge. That's why, because they're scared. Remember, they love you. Do you understand? So that's how I always say to them, remember, your family members, your partner, the love is there. Right? So when they react, the reaction is not you they're rejecting. They are afraid. They're thinking, I'm going to lose my loved one. That's where they're coming from. So they're not coming from a negative to say, actually, oh my God, it's
I
because
don't
of that.
trust you.
No,
No.
it's from a place of love.
Yeah.
Because all you think about, and I always use this. If I look at when HIV started in Africa, and even now, so many people are not on treatment.
Yeah.
Because they cannot afford to be on treatment.
Yeah.
Because we know 95% of African healthcare is private.
Yeah.
If you don't have money, you cannot get private healthcare. It's as simple as that, right? So
Yeah.
people are dying. So people don't test. Okay. So all you see is people dying. By the time they're diagnosed, then today, tomorrow they're dead. So all we see is death.
Yeah.
Yeah.
Do you understand? So you come into me as a family member with no knowledge whatsoever. All my knowledge is what I've had, intergenerational knowledge.
Yeah.
So my first protocol is that fear of thinking I'm going to lose you.
Yeah.
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 True.
So that's the reaction you tend to see. So that's why I always will prepare patients and say, look, when somebody actually acts in a different way, allow them time. But
They're
before
grieving.
you talk to them, I need you to really understand first yourself, so that you'll be able to break it down for them.
Yeah.
So they know
Yeah.
you're not going to die.
Yes.
Yeah.
Yeah.
Absolutely.
Yeah, because
And I
they
think-
probably don't have the
Yeah,
knowledge
they
as
don't.
well.
No, yeah.
And that's reality.
Yeah, it's
They
true.
don't.
Because
Yeah.
you don't assume that
Yeah.
not because the person living with it,
That's
they
right.
are knowledgeable of it or
Yeah.
understand.
Yeah.
So yeah, they probably don't have information on it.
No, they don't. They don't.
Yeah.
They don't.
Yeah. So yeah, it's where Errol is saying, ladies, you are giving us the blueprint for this.
Oh,
I thought I knew so much, but hearing from you all has added more depth.
thank you.
Oh, thanks, Ariel.
Thank you.
So yeah, that's mad. Yeah, because when you think about it, you have to think of it on all angles. for
Yeah,
you, because
You
yeah.
have to.
if the person isn't saying anything to you, it has nothing to do with you.
Yeah.
Yeah,
It
exactly.
all
Yes.
has
In
to
them.
do with
With
them.
them.
Yeah.
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 And they're probably not knowledgeable
Yeah.
enough to even know that they're they probably don't even know that they're
don't.
undetectable.
That's it.
Exactly.
To say they probably don't even feel secure enough to tell you that I cannot pass this on to
Yeah.
you.
Maybe they're doubtful.
They're not confident.
Yeah.
Yeah.
They are doubtful. Because I remember at first, when I was undetectable, I was like literally afraid to say it. Yeah, I can't pass it on because I
Yeah.
wasn't sure.
Exactly. Yeah.
To say because it's
Yeah.
like okay, I hear they say
Yeah.
you can't, but
Yeah.
if people are saying, if people ask the question to say none at all, you can't. I wasn't confident enough to say no.
Yeah.
I
Yeah.
cannot
Exactly.
pass it on. It's just over time.
Yeah.
After hearing it more and more, you
Get
know,
the
when we did the
education.
peer mentor
peer
thing,
mentor
training, yeah.
training,
Yeah.
and they break it down and everything, and let you understand that you cannot
Pass it on.
Yeah.
as long as you're undetectable,
Yeah.
you cannot
Cannot pass
transmit it
Yeah.
to anyone
Yeah.
at all. So so for me it's a build up of everything. So yeah, they probably don't even know that they're undetectable because
Yeah.
in some places
Yeah.
they just know that they're taking these medications.
That's
And
right.
it's
Yeah.
just to stop them from dying.
Yeah.
Yeah.
And that's it.
Yeah.
Yeah.
They don't
Yeah.
know that they can't pass it on.
Yeah. That being said, when I was in Zimbabwe, I was on the ARVs for years, and I was undetectable. But the guidelines say that we had to continue to use protection.
Yes.
So even
Yeah.
when I got married for the second time,
Yeah.
I was being told that I need to use protection.
That's right. Yeah.
Even up to the time I came here to the UK,
Yeah.
it's only
You knew.
it's only after I was here in the UK that
Yeah.
I was actually shocked. What you're saying? We don't need to use protection?
Yeah.
because it's totally different depending on where you are.
Exactly,
Yeah.
because the education that
Yeah.
you get is completely different. The care you
is.
receive is different.
Yes, it is.
Because here you've attacked the psychologists, you've got health advisors, you've got clinical nurse specialists. They're all there to provide you with the information and support you through it.
Yeah.
But then if you look at the African context, you just go and pay for your medication and get it. And to be honest,
Yeah.
this medication should be free anyway.
Yeah.
But some of them, people live miles and miles away to their nearest hospital.
Exactly.
You know, you're talking about 30 miles, 50
Yeah.
miles. And
Yeah.
women have to work all that distance. No cars. Come on. What do you expect?
It's not easy. And
It's really,
Yeah.
really tough.
Yeah.
So this is why I think about educating people is so important. And I see basic things like, well, I'm not going to say they're basic. Things like gonorrhea and chlamydia. So people look at it and they think, oh, it's only chlamydia, or it's only gonorrhea. But actually, it's not only.
Yeah.
Because this infection can become disseminated infections. People can end up in hospitals with them. Right? Yeah. I've had patients who, they've gone to hospital with an abscess on the leg. when they actually drain the abscess and do a culture, there's gonorrhea present in it.
Wow.
So they've contracted gonorrhea and it's disseminated. It can actually affect
it
your
can
whole
spread?
body. Yeah.
Oh my goodness.
Yeah.
I didn't know that.
That's what we call disseminated gonorrhea. And people can have, we call them arthritis, writer's syndrome.
Yeah.
They can have swollen knees. And you tend to see that. And that's because your chlamydia is actually spread to the knees.
Wow.
So these
That's worse than HIV.
Yeah.
and you're in so much pain when you have that, but nobody thinks about STD, sexually transmitted infections. All they think about, actually, my knee is swelling, I need to go to the hospital. It's all of that. When they start to do history, they realize, actually, then they end up coming to us, then we will give them simple medications, doxycycline, and that's it. You're done.
Yeah.
But then even with those, you still will have to say to people, your partner needs to be informed. And we have so many ways to do this these days. Anonymous providers, that's one of my favorites. I don't have to call you. All I do is send a text. It says NHS. You need to be tested for this because you've come into contact with it. What's easier than that?
That's good. Yeah,
That's good.
No naming.
No naming, exactly.
Yeah.
But even at that, if I tell you the amount of patients that will say no,
Yeah.
a lot of patients will turn around and say no. Sorry, no. I said, but hold on a minute. If he's a regular partner, you're gonna be
reinfected.
Yeah.
Again,
That's
it's
it.
that education, isn't it?
Yeah. Lamin from Spain.
Ah.
Oh, thanks for listening in, Lamin, all the way from Spain. Big up yourself. It says, keep up the good work, ladies. Just know that there are many like me out there who are learning a lot from your educative and insightful discussion. So proud of you all. And then Sona says, disclosures are mostly impossible in Africa. People won't even go to HIV clinics because you might be scared of someone seeing you and informing the whole community who are always ready to isolate you. So, wow.
Absolutely.
Wow. Should we take a break, ladies?
Yes,
Should we take a break? Yes.
In touch radio.
Yeah, somebody send in a request, so I'm going to play that request.
Brilliant.
Who I Am by Win Stark. So, if you're just tuning in, guys, yes, you are tuned in to the HIV Positive Show right here on Feminine Touch Radio. We're just going to take a quick break and get right back to you.
I've been closed in the dark all my life, held it in, but not anymore. Got 2 feet on the floor. This is it. I'm stronger than ever before. Pardon my imposition, but this is my conviction. I need to get this off my mind. I gotta be me, gotta be I, gotta be who I know I am inside. Can finally breathe, taking it in. Look at me flying. It's always been there, it just took me a minute to find it. If I were to be anybody else, I'd just be hiding who I am, who I am. Looking back on a little boy, never gave him a chance to ever be more. I didn't love him, but I'm gonna love him right now and forever. It's time to push open the door. Pardon my imposition, but this is my conviction. Ain't nothing left to hold me down. No. I gotta be me, gotta be I, gotta be who I know
Yes, welcome back, guys. If you just tuned in, you're tuned into the HIV Positive Show right here on Feminine Touch Radio. I just want to say thanks for those who are listening in, and for those who have commented on the chat. Thank you so much. You know, and to our anonymous person who has sent in that information. That's really good. Thank you so much, because we know that probably wasn't easy, but yeah, thanks for sharing. So as we said, guys, if you have any questions, you can send it in anonymously. You can, message us on Instagram, HIV Positive Show. We're also on YouTube at HIV Positive Show. So yeah, go on there, subscribe. Follow us, listen to the past show. You know, this show is going to be a recording that's going to be up soon. And yeah, go and follow us on Instagram, on our socials. And yeah, just, yeah, give us the confidence to keep going.
Yeah.
And put your questions in there as well.
Mohammed Jara's son. Oh, wow, mommy, I've been listening since the starting of the program. I'm so proud of you, mama. Oh, that's lovely. Thanks for listening.
Thanks, Sunny.
Oh, bless him. He's a trainee doctor, actually.
Oh, wow. Okay, lovely.
Nice.
So I keep saying to them, we need to teach them, because
Yes.
doctors, it's really surprising. I don't know, you know this, that, you know, you have doctors consultant level in hospitals who still don't have any knowledge around HIV.
It scares
You know,
me. It
yeah.
scares me. You know,
get patients coming out and say, well, I'm supposed to go into theatre, and what they did was to put me last on the list.
Yes.
Because everybody's thinking, because I'm HIV positive, so I need to be last on the list.
Yeah.
Hello? They don't need it. Again, universal precaution, just like we talked about earlier with the nail shop.
Yeah.
But these are educated medical doctors who you think should know better.
But they don't.
But they don't. And
Wow.
that's because it's not their field of expertise.
Yeah.
We're not saying that everybody should be an expert in sexually transmitted infections, but there are certain things I think is important for you to know.
Yeah.
So imagine in a hospital, you're getting stigmatized by medical trained doctors.
Yes.
You know, so it's tough out there.
It is.
It is really tough, and that's why people don't disclose.
Yeah. True.
Because it's just that fear of rejection. Talking about rejection, Donna, do you have any tips as a therapist in terms if somebody comes to you and said, how do I manage rejection? I know it's a tough question.
It is a tough question. Yeah, I would suggest speak to someone if it's starting to really affect your self-esteem, because this is about self-esteem and confidence. We're trying to support people to build up that self-esteem. Things can knock that for six, especially if it's quite fragile and it's someone you love, or if it's a doctor, someone in a position of power. Then there's a power dynamic. You're going to feel that you're wrong somewhere, that you're going to be judging yourself badly. So I would suggest speaking to someone. Come and speak to psychology, speak to your nurse, speak to your friends who you've opened up to, and really try and normalise that again, because you're going to start to feel that could be you at fault there. And it isn't. It's someone else's issues, lack of education. They need to be educated around that.
And I always say to patients, don't be afraid to educate me.
Yeah.
You know, I always say
absolutely.
this. A very good clinician should allow patients to educate them, because they know themselves better than you. And I always say patients need to learn to challenge. Because there are doctors and nurses who will say something or give you information that's incorrect. You know, I've said this to people. I've had staff who said to me, I remember I have a member of staff who was having issues with the son, and they were going to do they were not sure whether it's the genetics diagnosis or whatever. So I said to her, can you go onto the NICE guidelines? Can you check and read step by step what you expect for that appointment? The blood test that needs to happen. The guidelines are very clear. You go online, the NICE guidelines are there for the NHS. Any diagnosis you have, any treatment that you need to have, the pathways are there. I always encourage people, even in my community, I always say to them, before you go to any appointment, make sure you read,
so you know,
to understand what you are going to talk about, so that when they're telling you what they're telling you, they're not speaking jargons that you don't understand.
Okay.
Yeah, absolutely.
It's so important because we get dismissed.
Yeah, we do.
Okay, we
That's so
dismiss
true.
patients.
Yeah.
And then you can come out of that consultation with nothing at all. You don't hear anything.
Yeah.
Wow.
That's happened to me.
Yeah, exactly. You don't understand anything.
Not in the HIV clinic, no,
Yeah.
but at the GP, like,
Yeah.
yeah. But I like how, like, at the HIV clinics, they're so willing to give you whatever information you need.
Yeah.
They're very responsive.
Yeah.
Yeah. That's
I don't
true.
get care like that anywhere else
No.
in the UK.
Yeah.
The GP doesn't even
I tell you why.
listen to what you say.
I tell you why.
Yeah.
Our patients are very knowledgeable.
Oh, yeah. Yeah, well, yeah, we are.
I'm telling you,
Yeah.
our patients are very knowledgeable. Honest to God.
Yeah.
Okay.
When you're ready to go to clinic, you have to have your facts ready, and you need to know what you're talking about because they will challenge you.
Yeah.
I like that.
They're knowledgeable.
Power to the people.
Our patients are very knowledgeable.
Yeah.
And you see, sometimes this is what I talk about. You need to know what you're dealing with.
Yeah.
And this is why quite a lot of time patients will come out of consultations. I've been to the doctors, but they're not happy.
Yeah.
Because one, they don't ask questions. Because if you go back to my generation, and I'm going to say my generation because I'm old, yes, I am. Once you hit 50, I'm sorry, guys, I'm sorry whoever's out there.
You have a generation in it.
Yeah.
I'm so sorry, whoever's out there saying at me. But that's the honest truth. Because we are not trained, we are not actually, we haven't been brought up to challenge power.
Yeah.
Yes.
You know,
That's so true.
We're not.
Yeah.
You know, anybody who is
Yeah.
in a doctor's coat or in a suit or you're in a nurse's uniform, we think that you know everything.
Yeah,
Yeah.
exactly.
But actually, that's not true.
Yeah.
That is not true.
It's not true. No.
And it's not true.
It's a hard truth for a patient to actually accept that the doctor doesn't know everything.
That's right. And
That's
as
so
clinicians, I've always said, I've learned, and I've always said this, the amount, what I've learned from patients, it's unbelievable. Sometimes I have to start back and say, actually, say that again. Oh, hang on a minute. Let me just check.
Okay.
Because you have to be responsive. You cannot know everything.
Yeah.
And this is where humility comes in. And for a good practitioner, you have to have humility. Otherwise, you're not serving your patients.
No.
That's so true.
No.
And Jara, and I am aware that there are some patients that I know who have challenged consultants,
Yeah.
not in the HIV clinic, I have to say, but in the wider hospitals.
Yes.
I know patients who have challenged consultants because of discrimination.
Yes.
And you can't believe that these days that is still happening.
It does
but
happen.
It does happen.
It does happen.
Yeah.
And there is something called the Equality Impact Assessment.
Yeah.
Every guideline that you write in health, you should equality impact assess it. The whole point of that is to ensure that you're serving the whole population. If I'm going to change a policy, say for example, I'm going to change, say, triage.
Yeah.
If I decide that, okay, you know what, my clinic, I'm looking at the triage process. Okay. What do I need to think about for that process? Because I'm writing on a piece of paper, expecting that anybody that walks into clinic, when there are no appointments left, I want a nurse to triage you, right? I'm going to give you a piece of paper to choose why you are here today. Do you have any symptoms? Do you have lower tummy pain? But then hang on a minute. How about the people that can't speak English?
Wow.
Or read and write?
Yeah.
How about the ones that only do sign language?
Non-verbal.
Yeah.
Yeah.
Right? Non-verbal patients. Have I thought about it? What am I going to do for them?
Yeah.
But sometimes when we look at policies and everybody says, "Oh, you've got every policies in the NHS," but actually, have you equality impact assessed it? And that's so important. And
It is.
I challenge people all the time, and at work, people know me for that. You know, when it comes to things like that, they all know that you can't. I'm sorry. And this issue sometimes saying, "Oh, women come to an appointment with a child, or we can't see you." Oh, hello. What do you think? Where do you think they're gonna get childcare from?
Exactly.
Yeah.
You know, so we really need to think, and I think as clinicians, we have to be patient advocates. And I think NHS nowadays, we are moving away from that, and it's just becoming kind of like, I don't even know, like a conveyor belt.
Yeah.
So that passion that we need to have to do our job, you don't see that much. I know it's tough out there, especially in the hospitals. You don't have staff.
Yeah.
You know, on a ward of 40, you might get 2 qualified members of staff. It's tough, but I guess we need to just always think, about the patient. We have to have that empathy for the patients in front of us, and I think that's really important. We should not lose that, no matter how difficult the situation is. We should never lose that, because if we lose that, we'll lose the essence of being a doctor, a nurse, a support worker, or whoever that we're working with.
Because it's all about the patient.
That's right.
Yeah.
Well, without them, we don't have salaries.
Yeah.
Without patients, we don't have a job. It's true.
It is true,
Without patients, we don't have a job.
Actually,
We don't have a job. So I think we need, it's tough. It's not easy. I'm not telling you that working in NHS is easy. Or in healthcare, it's tough.
It is, yeah.
It is tough. But we always need to think about, why am I doing this in the first place? And think about that person in front of you. The here and now. It's really important.
Wow.
Yeah.
Wow.
Right. So let's talk about, I want to talk on dating apps. Have any of you used dating apps before?
No. Yeah. No.
I experimented with one.
And I'll tell you why I want to talk about dating apps. And the reason for this is I've had patients who would say, okay, because I'm HIV positive, I don't want to meet anybody, but at least with an app I can disclose. Because my name is completely anonymous. I'm not giving you my name. You know, even my pictures, sometimes the pictures they put there is a fake picture.
Right.
And because of the anonymity, they feel more comfortable on a dating app to actually go in and put, I'm HIV positive.
Yeah.
Some dating apps will ask you to actually disclose
Okay.
whether they're positive or not.
Right.
Others will not. But I've had patients to say, I feel a lot better doing it that way. However, some of them have said, oh, actually, when I did it, I had less likes.
Yeah, that's probably
But when I took it off and then changed my profile, it was okay.
Oh.
Wow.
Okay. That says a lot.
Yeah, exactly.
Yeah.
So and if you think of the dating apps that everybody's using these days, I didn't even know that you can chat somebody on what do you call it again? You know me, I don't do
Yeah, you don't do tech.
chat. What do you call it? Chat something. The kids use it a lot.
Snapchat.
Thank you.
Oh,
Snapchat.
Yeah.
When they use it as a dating platform now.
Yeah. They do.
Yes.
No.
Yeah.
The amount of young people that when we carry out a safeguarding risk assessment, we asked about where do you meet your partner? Oh, Snapchat.
Wow.
Yeah.
Yeah, 'cause
Snapchat.
even Facebook as well.
Yeah.
Facebook.
Snapchat.
I think all the platforms, TikTok.
Instagram,
Yeah.
TikTok.
Yeah.
Yeah.
I mean, I do see a lot of men in clinic.
Yeah.
Usually gay men.
Yeah.
Using platforms.
Platforms. Yeah.
Certain
Women are
platforms,
using it a lot as well. Heterosexual women's. Yeah.
Right.
Yeah, social media.
I see very
platforms.
few
Yeah.
women.
Yeah.
I'll be honest,
Right.
who
Yeah.
are using them.
Yeah, so you do have women who do
Yeah.
use they do use dating apps
Okay.
as well.
Yeah.
But I guess the reason why I'm bringing up dating apps, because obviously this is a health education show. I just want to advise parents, if they're listening, please educate your children around dating apps, or not only dating apps, any apps, social media apps they're using, because sometimes what children do is never put private. They might just leave it open.
Yeah.
And that then opens them to quite a lot of risks. So it's really important that you're educating your child around privacy for all their apps. Because we've recently had quite a few sexual assaults that children being assaulted, young people being assaulted because they met that person on Snapchat and that. So it's really important that we're educating our children. And please don't be afraid to have conversations around sexual health with your child. I know in our communities we don't do this because we pretend that they don't have sex and they're not going to have sex.
Oh, really?
It is really important that we're educating them and they're getting the best information from you. If you don't know, you can check any of the websites, any of the sexual health clinics will give you advice. I'd rather you teach the child with the right information than they go and learn it from porn or from the wrong source, because what they see, that's not what relationship is about. So that's just a message I thought today I need to really talk about, and this is because of what I'm seeing in clinic. So it's really important.
Wow, look at that. Wow. We got your son saying education is power. Utmost respect to you all. And he says, I'm learning a lot, as you always taught me.
You're a good mom.
So yeah, wow. Online. it's scary nowadays when I think about going online, because it's like, you don't even know who you're meeting, and you're going to be catfished.
Exactly. That's the first thing that comes to mind.
But there are good people. There are people who do meet their partners online. They have really good relationships online. And
I've known people who have met online, got married, have families.
I understand there's some dating apps or sites for HIV positive people as well.
Yeah.
How is it?
Yeah, they are.
But I wonder how effective they are at like finding really meaningful relationships.
I think people use it because I remember this was my HIV clinic days, and I know people. I can't remember, there was one website I used to give patients, and they do use it, and I think the reason why they do that, again, it comes down to the same thing, stigma. Because if you're HIV positive, I'm HIV positive, we are in the same boat. That's how they're thinking. It's better for me to talk to you because you will understand me than somebody else who is actually HIV negative. They might not understand me, and that's why really. But nowadays, people are moving away from that. Because come on, you equals.
That's
you.
the only thing we would have in common sometimes.
Yeah.
Is that we are the HIV positive, and that's it.
That's it. And you equals you's taking all that away, and it should take it away.
It should.
It should take it away because you're not going to transmit the infection.
No. You wouldn't. But then, that being said, you still find there are a lot of women who are trapped in loveless and toxic marriages and relationships just because they're both positive, and they're afraid that if they go out there, they're not going to be able to date anybody. They're not going to be able to disclose. So
yes, absolutely. And this is where your domestic abuse comes in. And then you've got this issue, right? And especially if you are the first person who get diagnosed before your partner, male partner, gets diagnosed, you have this burden on you, thinking I'm the one that gave it to him, but actually you don't know that.
No,
unless they do a sequence study on your blood samples.
You don't know who's giving it to.
Yeah, exactly. You don't know that. And yes, you do have that. Some women who just stay in these relationships and
just because of that.
But again, it comes down to confidence, and we cannot thank Donna and the psychological team. We cannot thank them without you guys in clinic. I don't know what we will do as clinicians in clinic, because some of the issues, as you rightly touched on, they're so embedded. You have to unpick them. And that unpicking could take time. So I do things like motivational interviewing for high risk patients to try and modify their behavior, because that's what we should do, right? But then quite a lot of them, when I start the conversation, you can see this is actually you're just scratching the surface of it.
Tip of the iceberg.
This behavior, they're not doing it because they want to do it. Something else is underneath there, right? So to unpick that, you can't. And this is where we have to then send to therapists for the therapist to actually start. And some therapists will start to work with patients. They start from the ground level. To just unpick until eventually you actually say, oh my goodness. This is because I will never forget, I had a patient who was a lecturer, was a professor. Never uses his name, would not allow anybody to see him. I was the only one that sees him. He comes in every time for Pepsi, which is your post-exposure prophylaxis. And I couldn't understand why. So he got referred to me for me to see him for motivational interviewing. So we started. And every time, and it took me over 6 months before I could actually understand
the real issue.
The real issue. 6 good months. And when I touched the issue, then I said to him, I'm not a psychotherapist. I need to hand you over to a psychotherapist. 6 good months.
Wow.
It's hard, isn't it?
It is hard.
It is really hard. And what I think is really sad is when I see, say, someone in maybe the PrEP clinic or even the HIV clinic, where they're looking for something from these dating apps, and they're not getting what they're looking for. They're getting something else. I mean, a lot of people use them for sex. And some people they're looking for love. So they're two different things, aren't they?
And it's really interesting that you could say that, because this is what's happened with this guy. He's been in a relationship for over 15 years. Out of nowhere, the person just terminated the relationship. So there was that rejection. So all he was doing, so in a way, it was self-harm.
Yeah,
really.
sure.
It was self-harm.
Yeah.
He was self-harming without actually knowing and understanding that what he's doing is self-harm. Because all he does is go out there and just do whatever.
Yeah.
Oh,
Right.
okay.
But then he knew was at risk. So every time he's coming in, he will be on Pepsi.
Yeah.
And won't even finish the first Pepsi we've given, he's gone and re-exposed.
Yeah.
So, but then again, you have to unpick it. But then when we went deep down, this started from when he was a child.
Yeah.
Yeah, it started when he was a child.
Yeah.
That's deep.
That's when then it became so anybody that he's with expects that loving relationship, and you couldn't get that after this relationship broke down.
Yeah.
He will meet people and he said, okay, you know what, oh, this is gonna be the one. They'll date 1 month, 2 months, and then the relationship goes down.
Yeah.
That's it. So he always felt rejected.
Right.
You know,
Yeah.
and this is why sometimes I say to people, you have to be very careful as parents. Sometimes what we say to our children at home,
Yeah.
things
Yeah,
like
absolutely.
words, very derogative words
Yeah.
like, oh, you useless, you this, you that. You
Yeah.
cannot do
Yeah.
that.
Yeah.
Because it does impact on their mental health, and sometimes it's not now, it's
Yeah.
later on in life.
Yeah.
And you won't even realize it.
That's right.
Okay.
Wow.
Yeah.
Gosh, I
Wow.
can't believe
Yeah.
the time.
Time.
Yeah,
Look at the
I
time.
know.
Yeah. Show is coming to an end. 7 minutes to go.
Yeah.
Right.
Wow.
Any take-home messages, Donna? Any take-home message to the listeners?
Wow. Well, firstly, thank you, because it's just been amazing to be here with you tonight. It's really been, it's opened my eyes as well. For your listeners, it's about opening up, being honest with yourself. If you need support, going and finding that support. If it's in your sexual health clinic, in the HIV clinic, speaking to someone you can trust. And if you can open up and you open about your status, sharing that in a really helpful way with other people.
Yeah.
So they take something really good from it and they can share that. And then once that message starts getting out there, it's building all the time. So that's what you're doing here. So thank you.
No,
for that.
thank you.
Yeah, thank you, Donna.
Any take-home message from you, Chida?
Yeah, I mean, I think mine is just a follow-on from what Donna's saying. You need to build up your confidence in yourself. If you understand the impact of HIV on yourself, you understand that you equals you. That is like the first step towards getting rid of self-stigma, because I know a lot of people who won't disclose or are afraid to disclose because they'll be afraid that, okay, what if it doesn't work out with this person? Then that means I'm going to end up telling quite a lot of people that I'm positive, but I'm not ready for the world to know.
Yeah.
But if you are confident in yourself, you understand what HIV is and what it means, then you won't really have these questions coming up in your head. And also to people who are HIV negative, if you don't really understand about HIV, just Google it. Well, maybe not just Google, but find resources from reputable sources, read about it, understand what it means if you get it or if you don't get it or if your partner has it. And if you are okay with dating somebody who has HIV, let them know, like the anonymous person who sent a message to us. Let the person know. This will empower them to speak about it, to be more confident. It's the HIV negative people that HIV positive people are afraid of being stigmatized by. So just education is power.
Yeah. That's true.
Yeah.
Oh, somebody just texted actually.
Oh.
Sam Collins. She used to actually be a health advisor.
Right.
Wow, no, it's absolutely brilliant. I'm sure that the show will make more people test and engage with HIV services.
Yes.
That's the vibe. Yes, I definitely come soon.
Yeah. Now we got Ariel online saying thanks for a very informative and open show. I hope you can continue this very necessary forum for us all to learn about HIV. Yes, we'll definitely be continuing because there's lots to talk about.
Yeah, so much.
And Mohammed says, I'm grateful for this opportunity and grasp the knowledge. Thanks, Mom, and to you all. Thanks, Mohammed. Thanks, everyone.
Thanks,
Ariel.
everyone.
Yeah, I think.
Thanks for listening
Thanks
in,
for
guys.
listening.
Thank you so much, everybody.
I think. Do you have any?
I'll just say, you know what? Take care of you, because once you take care of you, everything else works.
Yes.
I think a lot of times we sit down worrying about what other people having to say. But I think if you take the time out to take care of you mentally, physically, emotionally, then it won't matter what anybody else have to say.
Exactly.
That's right.
And as Chida say, get the knowledge you need. Even though you're living with HIV, you know, still get the